Our hospital started as a very small community hospital tucked in the backwoods of Nepean. And at the time, we really delivered primary community care. As time has gone on, we really have assumed a regional role, and we're a major referral center for all of the Ottawa Valley hospitals. So with that responsibility comes the need to really make sure that we are delivering high state quality care.
I've been involved with the hospital on and off for so long now. I sort of fell in love with the hospital. To me, it's the right size, it has the right attitude, it has the right care. It's a great hospital. My father's first association with the hospital was back in the late 1980s. He'd been asked by some community leaders in the West End to get involved and to run the hospital's first fundraising campaign since its opening in 1976. Because there was no foundation in those days, no Queensway Carleton Hospital Foundation, my father just subcontracted a bunch of people from Minto Construction Limited over to the hospital, and away we went. And I was in my late 20s at that point in time, and to see somebody like your father so involved and in a leadership role, it was very inspiring. Unfortunately, my father died a number of years after leading that campaign, so it's a very pleasant memory for me of my father and a wonderful time in his life.
Dan has taken up the torch and could really appreciate what his father, the value that his father too was further adding by his relationships and being able to bring together individuals that could provide donations to the hospital for the cause of the expansion of the hospital. And Dan and Barbara have continued that tradition as well too. And I can say it's delightful having that relationship with them, because you can tell with them that they feel good as well about what the value is that they've been able to provide.
When we had the opportunity to make a major gift to the Queensway Carleton and the Ottawa Regional Cancer Foundation and help establish the Irving Greenberg Family Cancer Centre, it was something that we'd been talking about for a long time, and it was really a neat idea, and we knew the dollar figure and everything. But the day that we announced it, we suddenly realized from the reaction in the room what a huge difference it was going to make to so many people's lives. And it really has, and it's been a wonderful connection with the hospital.
Our largest ever gift in all of Ottawa was made to Queensway Carleton Hospital through Dan and Barbara and the Greenberg family, instrumental in moving our campaign forward at that time.
This is a cancer center in the West End of Ottawa that's affiliated with the Regional Cancer Program. The synergy and the ability for us to deliver higher care is so much higher with this new facility. So the moment you walk in the door, you know that you're in a nice state-of-the-art facility. The staff is highly professional, and the quality of medical care that we deliver is second to none, certainly in Canada and internationally.
It's amazing to see after the most recent construction work how the hospital has changed. It's a much brighter hospital, and I think it matches physically, it matches now the attitude of the people, of the medical staff, the doctors, the nurses, and the other staff that work there.
The other great thing is because Dan was involved in the Carrick Rose West campaign for so many years, and we've gotten to know so many people at the hospital, so many people in the foundation office. So it's really like a family relationship in so many ways.
So I had the opportunity to work with Dan for 7 years while we raised $35 million for the transformation of the hospital. And honestly, Dan really wouldn't want to ask people to support. Dan would rather step in and either provide that support or a vehicle by which people could just be inspired to do that. And he did that with excellence. He really did.
In Canada, we have a very good healthcare system, but we have to realize that the government can't do everything. And so it's really up to private donors to step forward and say, wait a minute, it's important for us to help out. It's really up to all of us to pitch in, and then we get the health care that we need, and I think we get the health care that we deserve.
There's so many great things that the Queensway Carleton does. I think it comes through that attitude of caring, and it fosters an attitude of innovation.
It's really neat that Dan's late father, Irving, was involved in one of the earliest capital campaigns for the Queensway Carleton Hospital, that he believed in the hospital. He believed it was so necessary for the west end of Ottawa and to have an independent hospital there. And it's just wonderful that we're able to carry on his legacy.